Hi, everyone. I am Stephanie with 9Health, joining you once again. We are going live again all this week with ways you can help people in our state during the coronavirus pandemic. I'm joined via Zoom by the Executive Director of the Colorado Department of Human Services, Michelle Barnes, and also 9Health expert Dr. Payal Kohli will join us here in a few minutes. So if you have any medical questions about the coronavirus, you can ask those as well. First, I need to mention during this time, we have a lot of partners helping us out to deliver you some content, get your questions answered, connect you with experts like Michelle. One is Well Advised. They offer tools to make Medicare and healthcare less confusing. You can manage your care needs and your healthcare spending all for free at welladvised.com. And a reminder, we've launched our 9Health Neighbors program. If you have any medical questions or just need to talk to someone, you can call our 9Health Neighbors line and someone will call you back within 24 hours, answer your question, someone you can talk to on the phone. If you know people that don't have internet access or can't get online to ask questions, pass this along to them. We'll post it in the comments as well. Our 9Health Neighbors line is 303-698-4455, extension 2005. So again, call that number and a 9Health medical volunteer will give you a call back within 24 hours and answer your questions. But again, I'm joined by Michelle Barnes, Executive Director for the Colorado Department of Human Services. Thank you for joining us.
Oh, thank you for having me.
So first, for those that don't know, I wanted you to just explain what your office does during this coronavirus pandemic, what your role is.
Sure. So the Colorado Department of Human Services, we're the people that help people. We provide a lot of essential services during COVID-19 and all the time to families that need a little help to thrive. An example would be food assistance programs, adult and child protective services. We license child care centers. We run the state mental hospitals and offer things like foster care and adoption services. So any service that's more of a people-to-people support service is under the Department of Human Services. We've always offered these, but now with COVID-19, we're finding more people in our state need more services with more urgency. So we're just doing what we do, but at a much more accelerated rate.
And talk about some of the services that you provide and maybe that others can help with, because we kind of want to focus this week on how others can help others in our state. So if someone's at home looking for ways to help, what are some ways that, or what are some needs, I guess, some help needs out there right now?
Right, that's a great question. One of the biggest needs in any type of crisis like this is the need for volunteers to supplement some of our essential services. There's a lot of amazing nonprofits in Colorado who are continuing to provide frontline services, but they're finding their volunteer base is a little bit diminished. So this would be a great time to offer to volunteer, and you can sign up to be matched with organizations looking for volunteer help if you go to helpcoloradonow.org, and they've got a plethora of COVID-related volunteer opportunities for people.
Yeah, I was going to share my screen really quick just to show everyone the website. It's helpcoloradonow.org. And again, it lists different resources and different things. So resources if you need help, but then different ways to help. You can become a healthcare volunteer, become a volunteer. If you need funding, you can donate any supplies that you have. Again, masks, gloves, cleaning supplies are still a critical need. Contribute to the state coronavirus fund, blood donations, which we'll talk a little bit more about this week. We'll host a town hall where we'll have several experts talking about ways that you can help. And then child services for first responders is on here. So I know I said I would talk about this with you a little later. Let me stop sharing and get back to our meeting. And Dr. Payal Kohli has joined us. Hi, Dr. Payal Kohli, 9Health expert. I will ask her for an update on the coronavirus in just a moment. But first, Michelle, you guys made a big announcement today for childcare for essential workers. Tell us a little bit about the announcement and what is available now.
We did. We've been trying to offer emergency childcare for essential workers for the last couple weeks through a public-private partnership. Thanks to the federal relief funds that are coming to Colorado, we're now able to announce that we can offer 6 weeks of free childcare to families of essential workers. So if you have a child between infant and say 14 and you need childcare for them so you can continue going to work, we have a website that you can go to and sign up, and the state and the federal government will underwrite your childcare costs for up until May 17th. And the website is covidchildcarecolorado.com. And we're really excited to be able to offer that. We know childcare is an essential service for many Coloradans, and we're just thrilled to be able to provide that.
Yeah, that's great. So again, covidchildcarecolorado.com. I can post that in the comments. If you are an essential worker and in need of some childcare, the state's providing underwriting for childcare, which is great. And Dr. Coley, since you've joined us, let's get a quick update just on the coronavirus. I know everyone wants to kind of know where we're at if they haven't heard today. Just give us a quick update.
Yeah, I just want to talk a little bit of big picture today. Yesterday was a big day because we learned a couple of things. One is we learned that social distancing is starting to work, but that we still have a ways to go. So as you heard from the president, we're actually now going to enforce this until April 30th, and probably, to be honest, a little bit longer, depending on when everybody peaks and starts to come down. The other thing that we learned that was a little bit kind of a little scary for everyone in the community was the numbers of potentially Americans that could fall victim to this virus. By Dr. Fauci's estimates and some modeling, about 100,000 potential American lives lost to this. And I think that's just a sobering reminder that this thing is real, it's here, and we really have to make sure that we continue to keep doing what we're doing, because it looks like it's starting to work. It's a little early for us to tell and have data available, but it appears that it's working. And we just got to keep doing it harder in order to keep that 100,000 number at bay as much as possible.
All right, thank you for that. Again, everyone, you can ask your questions to either Dr. Pal Coley or Michelle Barnes. She's the executive director of the Colorado Department of Human Services. They're the people that help people, like she said. So they're a great resource if you have any questions about getting help, if you want to help and volunteer. And Michelle, I asked you about what positions are maybe needed or things that people can help with at this time. But what is the biggest need that the state has right now if someone is looking to help?
Right now, we're finding medical personnel are our biggest need. Our workers are doing heroic duty to keep supporting the healthcare needs around the state, but we're asking people that maybe you've been a healthcare worker and you're retired or you're currently not working to consider volunteering to join one of our health initiatives during this time. I'll also mention something that we're asking every Coloradan to do is be on the lookout for concerns with families in this time of stress. We get about 200,000 calls every year to our child abuse and neglect hotline. As soon as schools closed due to COVID-19, we saw that number drop by over 40%. I don't think that it's fair to say that there's 40% less child abuse and neglect. I think that now that we don't have teachers and people having eyes on the children, we're just having less reporting of it. So please check in with your friends, your neighbors, your kids' friends, just to make sure everything's okay in their home, and let us know if we can help if they aren't.
Yeah, I think that's great advice. And Dr. Coley, in this world of social distancing, what's the best way for us to check on our neighbors? Knocking door to door is probably not the best thing. Just calling, texting.
Yeah, just what we're doing now. Zoom meetings, calling, texting. It's the best way to do it for sure.
We did get a couple questions on Facebook. Again, you can ask any questions to Dr. Coley or to Michelle from the Colorado Department of Human Services. Someone did ask, we're getting coronavirus questions, of course, but someone asked about the virus surviving in the air. I know there's been some debate. Is it airborne? Is it not airborne? Surfaces, what should we be worried about? Dr. Coley, can you just talk about that?
Yeah, so New England Journal of Medicine put out a study last week that confirmed that viral particles can persist in the air for up to 3 hours. So certainly that's called airborne. But really what that means in the realistic sense was that these particles were aerosolized under very special circumstances where they were nebulized into the air. And so we don't believe that the primary mode of transmission is airborne, meaning that it stays in the air for several hours after somebody's gone. We still think that it's primarily respiratory droplets. So you really have to have close contact with somebody, or if they have enough respiratory droplets, they could persist in the air for a few minutes after that person leaves. So for example, if I sneezed and then got up and walked away and you came and sat down exactly where I sneezed, it's possible you could be exposed to respiratory droplets. So I generally encourage people to keep doing the social distancing, but also if you're out running in the park or something, try not to run directly behind somebody, especially if they're breathing heavy or coughing or sneezing, and just be mindful of those types of things. But the virus itself is not thought to be airborne. In terms of surfaces, it lasts about 3 days on stainless steel and plastic surfaces and about 24 hours on cardboard. about 4 hours on copper.
Okay, and we talked about social distancing, checking on your neighbors, give them a call, give them a text. Michelle Barnes with Department of Human Services was talking about making sure you check on your neighbors in this time of need. Michelle, I wanted to ask you, you were talking about childcare for essential workers. Can you reiterate what an essential worker is and define that so people know exactly who is able to get help with childcare? And maybe for those that just joined us again, restate the announcement that you guys made today.
Sure. Earlier today, we announced that the state will be subsidizing childcare for essential workers up until May 17th. Essential workers is a category that's continuing to be expanded and defined by executive order from the governor and from the Colorado Department of Public Health. Right now, it is a pretty large net. It includes people that are obviously medical workers, public safety workers, people that work in our jails and prisons, people, grocery store workers, people that are essentially required to continue working during this time to provide the goods and services we need in the state. It's on the website, covidchildcarecolorado.com. We list who the essential workers are. And if you have any questions whether or not you are considered an essential worker, please just go ahead and fill out the questionnaire and we'll get back to you either way and let you know if we're able to provide childcare for you. It's something we're really excited to be able to offer, and we're just announcing it today due to the provision of some relief funds coming from the federal government that'll directly underwrite childcare.
Yeah, that's great. Help for those that are really, on the front lines of this, especially the healthcare workers. Someone did ask on our Facebook page, so Michelle, I'll see if you can answer this question. And I know the Department of Human Services connects people to housing services as well, but someone asked about the homeless population. Denver Rescue serving meals over the weekend, they didn't appear to be honoring physical distancing, so I don't know whether or not that is true, but should people serving the homeless be wearing masks? How can we support this vulnerable population? Maybe you can just talk about the homeless population, what's being done.
Yeah, that's a great question, and I'll refer to our medical professional to answer the social distancing. But yes, right now, people supporting homeless and low-income people are absolutely frontline essential workers. We are asking them to follow social distancing. A lot of them are in desperate need of volunteers to continue to be able to offer their services. Quite a few counties have opened up housing for homeless population in hotels, dorms, other places to get them off the street and allow them to be able to keep appropriate physical distancing so they're not living on the street next to a lot of other people. There's meal services for them. There's healthcare services for them. If someone really needs to be connected up to services, you can call 211 from anywhere in the state and they'll connect you to the services available in your county.
Perfect. Yeah, 211. And again, there's a new state website, helpcoloradonow.org, where you can click to volunteer, or you can also find the resources that you might be needing, childcare, housing. Someone did write in the Facebook comments, message me if anyone needs childcare. I'm not sure who they're with, but again, Michelle, it needs, for the childcare funding that you're providing, it needs to be a licensed childcare. Talk about what licensed childcare means for those that might not.
In the state of Colorado, we license childcare facilities. That means the people working there are background checks, that they're regularly inspected for health and safety, that the workers there have the right credentials. So we're doing the subsidies through licensed childcare centers. So you'd have to be willing to participate in that. If you're getting childcare from a neighbor or a kin or a family and friend, that would qualify for the tuition-free childcare at this point.
Okay, and Dr. Coley, we're getting a couple medical questions that I think you can answer on the Facebook page. Someone's asking about a sauna, if a sauna can kill the virus. I don't know where someone would be going to a sauna right now, unless it's your own personal sauna at home. But maybe just the temperature question, because another person asked about temperature and it living on surfaces. So maybe you can address that.
Yeah, so we do know some things about the temperature sensitivity of the virus, but what it seems is that it really requires extreme temperatures for inactivation of the virus. So, and those are temperatures of 140 degrees or 150 degrees Fahrenheit. And saunas are particularly humid environments as well. So that can certainly alter the characteristics of how easily it spreads. In general, what we know about the virus is that it likes to spread in cold and dry climates for the most part. But we've also observed that it spreads in hot and humid climates just a lot slower. So less proportion of the spread occurs in hot and humid climates, and it's slower. But I don't think the temperatures in a sauna would be quite enough to inactivate the virus, but it hasn't been fully studied.
And then someone's asking about, they stated that medical workers are only being tested if they have a temperature. I'm not sure if you can speak to the validity of that or not, but talk about signs and symptoms. And someone asked, is temperature the first symptom that you would get if you had the coronavirus?
So temperature is the most common symptom that people have during the course of their illness, but not necessarily the first symptom. And really what causes the temperature or the fever is when the body is mounting an immune response to the virus. So you can get infected with the virus, have it replicate for several days. That's usually the asymptomatic or pre-symptomatic phase. And then the first symptom, earliest symptom, usually tends to be cough because it starts irritating the lining of the lungs, and that triggers that cough sensation. And then when the body mounts that immune response, that's when you get a fever. So based on the data that we've seen so far, about 45% or so of people had a fever in the first week. And then out of those that got hospitalized, about 88% had it during their hospitalization in the second week. So most people will probably get a fever. It's a minority that don't get a fever, but it usually happens later when the body's kind of mounting an immune response against the virus.
Okay, Michelle, we got another question that I think you might be able to answer on the Facebook page. Someone's asking any help for illegal immigrants in Colorado. Are you able to speak about that at all?
I am not able to directly speak to that. The same services that were available to all Coloradans would continue to be open to them. So please reach out through 211 and we'll connect you to any services that we can that you're eligible for.
Okay, that's a good answer to that. I think, you know, it's open to anyone. The services are being given to anyone at this point during this pandemic. I'm seeing if we have any other questions that you guys can answer in here. Michelle, this might be another good one for you. Someone says, I'm battling anxiety and depression. Can you talk about some of the resources that the state has for mental health?
I'm really glad you asked that question. We know that people that suffer from mental health conditions are at a heightened sense of crisis during this pandemic. And so we want to let you know that the state crisis lines and mental health providers all around the state are absolutely open for business. And you can access them by calling 1-844-493-8256. The only difference is your appointment, instead of being in person, will probably be a telehealth appointment, but we really encourage you to reach out and ask for help. We can connect you to services in your local community, as well as get you in touch in front of a mental health provider as soon as possible. So please reach out and know that this is a really stressful time for a lot of us, even people that may seemingly be fine on the outside. This is a great time to help your friends and family get help.
Again, check in via text, cell phone, check in on your neighbors, check in on anyone that you love and know, family, friends. We did talk about mental health all last week on our Facebook Lives. You can also go to the 9 News and 9 Health Fair Facebook pages and rewatch some of those. And at 9healthfair.org, if you click on eTools, we have free anxiety screening and depression screening that you can take and be connected to some free in-person virtual help, but someone will contact you. We also have our new 9 Health Neighbors program. If you have any medical questions about the coronavirus, mental health, really anything, you can call our 9 Health Neighbors line, 303-698-4455, extension 2005. So that's another resource out there for everyone. 9 Health Fair, the state, there's lots of resources out there for you. Dr. Coley, there's a couple other medical questions on here. And I will let you ladies go in a couple minutes. I think I told you 15 minutes, but let's answer a couple more questions and I'll let you guys go. Someone asked about the risk to a newborn, which I think is an interesting question. Now I have a 4-month-old and I was kind of this whole time being like, oh, it's affecting the elderly. It seems that babies will be okay. There was the death of an infant recently. So maybe just talk about the risk to babies and a newborn specifically, as this person asked.
Yeah, so some new data just came out from pediatrics that looked at about 2,100 Chinese kids who contracted the virus, and only 5% of them had critical illness or got very sick. The rest were either asymptomatic or had mild illness. But of those 5%, the majority, not the majority, excuse me, 11% were babies under the age of 1. So 1 in 10 of the kids that got sick were babies under the age of 1. So that certainly concerned us a little bit more than we had, paid attention to in the past, because newborns, they do have an immature immune system, and it seems like they may be at higher risk for having critical illness. There have also been a couple of case reports over the weekend that have come out in the Journal of the American Medical Association that have described the possibility of what we call vertical transmission, which means that mom is infected and the baby gets infected in utero or before the baby is born. Again, these are case reports, so we're not quite ready to make big decisions based on these yet, but it's early evidence that maybe we're still learning more about this in babies than we knew up until now.
And then Michelle, another question that came that you can possibly answer. They said my EBT benefits were cut by more than half in a reevaluation recently. Can they get those reevaluated or reviewed during this time if they need that done?
Yes.
And maybe explain what EBT benefits are for those that need to know.
In Colorado and around the country, we're able to offer food stamp and energy assistance benefits to qualifying families. And I do want to put it out there, Colorado is one of the states that does not have a high participation rate on this. So if there's any concern with your family to pay your energy bills or to get some money for food, please apply. And you can do that through 211. If today, as always, if you have a concern that your benefits were cut inappropriately, please do reach out and appeal, and we'll relook at that immediately.
So that's good to know. There's still the staffing available for stuff like that. The office is still open. You guys are still running.
Open, but as Governor Polis has asked us to do, we have more than 50% of our workforce working from home. So regardless of what county you're in, please know that there's human services workers there to help you. They just may be doing it from their home office at this point.
Right. And then one more medical question, Dr. Coley. Someone asked risk to diabetic and risk if they're asthmatic. So if they have asthma or if they're diabetic, their risk, are they in a high risk group for coronavirus?
We do know that they are, unfortunately, so those people have to be extra careful. They're no higher risk necessarily for contracting the virus, but certainly higher risk for complications when they get it.
Okay, and if there's additional questions, you can put those in the Facebook feed. I'm going to let these two ladies go. Both of them will join us, I believe, on Wednesday for our bigger town hall. We'll have several experts on with different ways that you can help others in our state. And if you need help as well, it's a good time to tune in and learn about resources. I want to thank you both for joining us, and I'll post some of the resources that Michelle alluded to in the comments, and also the number for our 9 Health Neighbors program. Again, reach a medical professional. Someone will call you back within 24 hours. If you have a question that you need answered, 303-698-4455, extension 2005. Michelle mentioned COVIDchildcarecolorado.com. That's where you can sign up and see if you're eligible for those child care benefits, paying for child care for essential workers. And the state crisis mental health lines, I'll post that number in the comments as well. And then helpcoloradonow.org is where you can click to volunteer and find out about some of the other resources in our state, whether you need to volunteer, you need resources yourself. So thank you, ladies, both for joining me. I'm going to sign off and let you both go. And we will be back tomorrow with more details on our 9 Health Neighbors program. We'll be joined by 2 doctors who are volunteering for that program, and our director of volunteer engagement will join us as well to discuss what that's all about. And Dr. Coley, I believe, as well, to answer your coronavirus questions. So thanks, everyone. We're going to sign off for now, and we'll talk to you tomorrow.
Thank you.
Thanks.